technical difficulties in getting our guest logged into the briefing today, so we'll keep working on that. But in the meantime, we'll proceed until we can get her looped in. I do want to announce that American Sign Language interpretation is available today. If you search for interpreter stubs, you can hover over the 3 little dots in the window and you can lock it in place on your screen. Oh, and it looks like our guest has joined us, so that's great. Today, we're going to hear from Health and Welfare Director Dave Jeppesen, our special guest, Paula Kelleher, who is the superintendent for the Nampa School District and president of the Region 3 Superintendents. We'll also hear from Deputy State Epidemiologist Dr. Kathryn Turner and Public Health Administrator Elke Shaw-Tulloch. And with that, I will turn it over to Director Jeppesen.
Thank you, Nikki. Appreciate you getting things going here today. Welcome everyone to our weekly COVID press briefing. And again, thank you to Paula Kelleher. She is the superintendent of the Nampa School District, but is really here today in her role as the president of the Region 3 Superintendents. And we're glad that she was able to join us and get through some of those technical difficulties. Crisis standards of care remain in effect statewide. The number of COVID-19 patients continues to exceed the healthcare resources available, and we see that in our hospitalization data. So we will show our usual chart here, and I'll give Nikki, oh, there it is right there. As a reminder, this shows the average daily census since the beginning of the pandemic. And these are the latest numbers as of Saturday, September 25th. And the key message remains the same. The hospitalization numbers continue to set record highs. You can see in this chart that our number of patients in the hospital was at an average of 757 last week. That's a record. Our ICU patients was at 202 on average, again, another record. And ventilator usage was at 131, more than double the previous high. Thank you, Nikki, for sharing that chart. We expect these numbers to continue to increase. We do not see where this is going to turn around just yet. In addition, there are 140 long-term care centers with current cases of COVID-19. That's up from 14 in early July. As I said last week, the dedicated healthcare professionals across the state need our help. They need the unvaccinated to please consider choosing to get vaccinated. The vaccines work, they're safe and effective, and they need us all to please wear a mask indoors and in crowded outdoor spaces. And with that, I'll hand it over to Superintendent Kelleher.
So thank you, Dr. Jeppesen, for the opportunity. I'm just checking to see that you're hearing me.
We can hear you, yes.
Right. So I just want to thank you for the opportunity to share a little bit about what's going on in our schools, particularly across the southwest area of Idaho. I'll share a little perspective of the Region 3 districts. I'll also share some data related to Nampa School District itself. I want to start by thanking our medical professionals who have cared so diligently and compassionately for those that are sick, both in our hospitals and in our clinics. Region 3 superintendents really wanted to start the year and committed to trying to keep students on our campuses. 77% of us have been able to keep our campuses open, full-time students in our classrooms. Another 15% have found that they needed to close a certain school for a certain length of time in order to make sure that their operations could continue smoothly and safely. In the Nampa School District, we did close an elementary early on, added to the Labor Day weekend, and then we were able to open. 30% of our staff were either tested positive for COVID, were waiting test results, were out because they were a close contact, or they were sick for some other reason. Today, we will notify another elementary building. We have 14 staff out, 2 of them which have tested positive, some who are waiting tests, and others whose children have tested positive and they need to be home to care for them. 95% of the districts in Region 3 are experiencing the same type of situations that Nampa did when we didn't have enough substitutes to cover the first elementary or the elementary that will be closing for 3 days this week. There are over 200 classrooms in Southwest Idaho right now who do not have a a substitute in them. So they're open classrooms and schools are scrambling to meet those needs. We're grateful for the monies that are coming from the governor's office to help us support attracting and retaining those substitutes, our paraprofessionals, the bus drivers, and our nutrition services folks. Although over half of our districts in Southwest Idaho saw an enrollment increase this year, many of us are experiencing an attendance decrease. In Nampa, for example, 80% of our students weren't attending regularly during the first four or 5 weeks of school. It has stabilized a little bit, but we're still missing about 15% of our high school students, 12% of our middle school students, and about 10% of our elementary school students every day. Our parents do call in and tell us that the children are sick, but many of them choose not to go get students tested. So when you refer to our webpage, the reports that we are reporting related to positive student cases, those are only cases that we can actually confirm. 50% of Region 3 districts have seen an increase in the number of COVID cases compared to last year. 38% would say that they're experiencing about the same rate, and one district reports a decrease in the number of students testing positive for COVID. Nampa School District is averaging over 100 students per week who are testing positive. Again, these are cases we can confirm either through our partners in Southwest District Health or through a provider or parents show us the evidence of the test. We are currently nearing 600 student cases. That number we did not see last year into the middle of January. So in the first 6 weeks of school, we're at about the same number we were as we were approaching the middle of January last year. We have 56 positive adult cases on our campuses. A significant barrier for us has been access to the rapid COVID tests. So many of our teachers are waiting for the return of their test results before we can move them back into the classroom. Again, we're thankful to the governor for additional monies issued to the Department of Health and Welfare for us to access additional testing support and help. We are currently experiencing, just in the Nampa School District, a daily incident rate per 10,000 of over 10. We've averaged this over the last 4 weeks. In our county is experiencing that rate of only 6. 46% of the cases that you'll find on our school website are coming from our high school students, while 30% are coming from our elementary schools. Those tend to be children who are not yet 12. To date, 4% of our full-time staff have tested positive for COVID, and 3.5% of our student enrollment have tested positive. This morning, as we analyzed data for last week, was the first time in this 6 weeks of school that our elementary positive cases have exceeded our high school positive cases. And it's interesting to note that 30% of those cases in the elementary are coming to us from our preschool, our kindergarten, or our first grade classrooms. Unfortunately, across Southwest Idaho, we have experienced staff who are very sick and have been out for extended periods of time.
Superintendent, I think we have lost
What Director
you.
Jeppesen has said. Oh, okay.
Apologies. I think we might want to repeat the last sentence or two that you said. Okay. I think we're muted out a little bit.
Okay. So I just have mentioned that we do have staff members who are very sick and have been out for extended periods of time across Southwest Idaho. We have mourned the loss of colleagues and loss of staff members and parents of our students this year. We want to encourage you, just like Director Jeppesen says, vaccinate where you can, wear face coverings, help us keep our students in school by working the mitigation strategies out in the community. I want to end by expressing thanks for our teachers and our nursing staff, those who have spent hours and hours at preparing for students and caring for them. They're tired, they're weary, they would love for COVID to be over as well. Until then, they're showing up as often as they can when they're not sick, and helping us to continue to educate our students. So thank you for the opportunity to share a little bit about what's happening in schools across Southwest Idaho.
Thank you, Superintendent Kelleher. I think Dr. Turner is next for opening remarks.
Thanks, Nikki. Good afternoon, everyone. I'm going to spend just a little time drilling down into our case trends and focus on what we're observing among Idaho children statewide. Weekly case counts among children are increasing more rapidly than our case counts among adults. In fact, infections among children have reached record levels in the past few weeks, and right now 20% of all new cases being reported are infections in children, which is much higher than what we were seeing this time last year. In mid-December last year, we peaked at just over 1,100 cases reported in 1 week among Idahoans less than 18 years of age. You can see in the chart that you should have on your screens right now that the number of infections identified among children has recently skyrocketed. We surpassed our previous record set in December of 2020 a month ago, when just over 1,300 cases in children were reported during the last week of August. Last week, nearly 1,700 cases were reported among children. In fact, the weekly number of cases identified among Idahoans less than 18 years of age has doubled since mid-August. Thanks, Nikki. The result of these additional cases of COVID-19 in children has been increased pediatric hospitalizations. Although we have observed over the entire course of the pandemic that children are less likely than adults to experience severe illness, just over 200 Idaho children have had to be hospitalized for their illness since the start of the pandemic. And in addition, 31 Idaho children have developed a post-infection complication called multisystem inflammatory syndrome, abbreviated as MISC. With MISC, different organs of the body become inflamed, including vital organs such as the heart, lungs, kidneys, and brain. And about half of the children with the syndrome are so ill, not only are they hospitalized, they require care in the intensive care unit. So while it's true that severe illness among children may be rare, the risk is not zero, and it's important to reduce the chance of transmission to children or among children. This can be achieved by getting more Idaho children 12 to 17 years old vaccinated. The Pfizer-BioNTech vaccine is authorized for that age group. Keep your children home if they're ill. That's very important. And encourage and model responsible behavior such as masking when indoors, washing hands frequently, and physically distancing when appropriate. That can all go a long way to reducing the risk of infection. And I'll turn it now to Elke Shaw-Tulloch.
Great. Well, thank you, Director. Thank you, Paul, and thank you, Kathy, for that important information. We continue to support our healthcare partners in schools, and I would like to provide some updates from my comments last week. So for staffing support for healthcare entities, 344 of the 576 requested and approved positions have been filled as of today, including 253 clinical and 91 non-clinical positions through the state's GSA contractor, the Idaho National Guard, and other sources. Staffing continues to be spread across the state to 15 different locations comprised of hospitals, clinics, health, long-term care facilities, and local public health to support their local response activities. We've provided 36 hospitals with over $2.5 million in support grants, with more funding on the way, as well as 20 freestanding primary care and urgent care clinics, the total of $4.5 million in grants. Additionally, we now have 51 kindergarten through 12th grade schools or school districts that have indicated an interest in funding for COVID testing and support. Funding is in progress, meaning our sub-grants are in the process of going out the door for signature for 17 of those organizations. $3.8 million has been requested that will benefit over 71,000 Idaho K-12 students. Funding was declined by 6 of the school organizations that only want access to testing kits. So to help solve for that, the state has entered into a new contract with Vault Medical, finalized this week, to make test kits available. This contract is specific to schools to provide these vault test kits, and the schools that use these test kits will not have to report aggregate testing data. Vault will report that directly to the Department of Health and Welfare on their behalf, so we can make sure we keep everyone up to date on the cases in Idaho. $10 million has been set aside or has been entered into contract with Vault Medical. Because of demand for more timely results than Vault can provide, because they're those PCR-based tests that they're diagnostic tests that take longer for the results. Our Idaho Bureau of Laboratories has exploring contracts with companies providing more rapid tests, such as the Abbott Buy Next Now rapid antigen tests, or the Q PCR-based 30-minute tests. So testing remains incredibly important for our communities, as well as to identify COVID cases so people can immediately self-isolate to prevent further spread of the virus. Testing locations can continue to be found at gettestedcovid19.org. The department continues to offer free Vault saliva-based PCR test kits through the Idaho Care Line, but on a limited basis, as we have only a little over 40,000 test kits remaining. We also continue to support community partners providing testing across the state. I want to reiterate from last week that testing turnaround times for PCR or diagnostic tests continues to be a little slower than they were previously due to more tests being conducted, but tests continue to be largely available across the state. On the national level and impacting Idaho, the rapid tests are facing supply issues, so they're on a bit of a more limited availability. If you need a test for an event or travel and you are asymptomatic, please be patient and plan ahead. And please do not go to the hospital for asymptomatic testing, as we mentioned in multiple weeks. So in closing, I want to continue to say that we need your help. We've heard that already today. We need your help to keep our schools, our businesses, our hospitals, and our communities open and functioning. We need your help to prevent the spread of the disease impacting so many lives. You just heard from the previous speakers about people getting sick and impacting our schools, our hospitals, and our workforce. It seems that we're all at a time where most people now have personal impacts from COVID in one way or another, myself included. Just this week, for example, I had a family member who is a healthcare worker tell me about watching a ventilated, non-vaccinated patient die, and then she had to help zip that person into a body bag. And unfortunately, that's a task that too many of our healthcare workers are having to do right now. Additionally, I've had the opportunity, and I would say privilege, to see every single notification of a COVID-related death in Idaho. And as you can see, every week it's getting very emotional for people. I've deliberately looked at every single one of the 2,790 names of individuals who have lost their lives. I feel it's important to honor them by reading their names and acknowledging their humanness, not just see them as a data point. I see that they're getting younger, and as you heard at the beginning of this briefing, they're predominantly unvaccinated. I worry every single day about the potential of seeing a child's death notice, because perhaps they were too young to get the vaccine or had underlying health conditions that prevented them from getting the vaccine. I worry every single day that we have not done enough as a society to protect our loved ones from needless suffering, and we have let a narrative prevail that does not support vaccines and public health mitigation measures. I worry that our kids will have lifelong impacts from schools closing or changing instruction methods to accommodate the unmitigated virus, and sometimes having to watch their teachers and students and school staff dying from the virus. I feel our kids deserve the best, and the best, in my mind, is enveloping them in a bubble of protection with more people getting vaccinated, wearing masks, and getting tested. So with that, I'm going to turn it over to Nikki for some of our questions.
Thanks, Elke. Okay, we will now take questions from the media. I see some hands are raised there. Please raise your hand in WebEx or type your question into the chat area. When I say your name, unmute yourself and announce your name and media outlet before asking your question, and please remember to clear your hand when you're done. So let's see, our first question will come from Audrey Dutton.
Hi, thank you for providing all this information for us, and I'm sorry that you're having to report all of this, and sorry that you're having to be concerned about seeing a child's death notice come through, Elke. I have a pretty hard question that's semi-related to that. How many fetal deaths or stillbirths have there been among women with COVID, and are those considered to be COVID deaths, or are those characterized as something else?
Well, thank you, Audrey, for your comments. Appreciate that. As you all can see, feels like it's getting harder and harder every week to do this as we see things come along. I do not personally know the answer to that, and I don't believe that's information that we have readily at our fingertips. But I'm going to turn to Dr. Turner to see if she has any further information.
So, Audrey, can you repeat your question, please?
Yes. How many fetal deaths or stillbirths have there been among women with COVID?
Yeah, Audrey, so I wanted to make sure I understood your question. We receive electronic death record notices sort of automatically, but we are going to have to check with our vital stats team. That stillbirths, fetal deaths are not something that would come through an electronic death record notification because there's no death certificate that's associated with that event. So I think what we should do is circle back after the call, and we can work with our colleagues that work in the vital records office and get that information for you.
Thank you.
Okay, our next question is going to come from Tristan Lewis.
Hi there, Tristan Lewis with ATVB. My question has to do with anybody able to touch up on just the vaccine and impacts it might have on other diseases. I mean, we've seen some articles and quotes circulating just social media, the internet, that the vaccine may suppress T cells. Would anybody be able to touch up on if there would be an increase in diseases such as cancer from the vaccine? Is this just more misinformation? Would anybody be able to clear that up?
Yeah, thank you, Tristan. Dr. Hahn, can you address that question?
Yeah, thank you. You know, I think, Tristan, thank you for the question, first of all. So this is the first I've heard of that particular question. We appreciate, a lot of times you guys hear the rumors or the concerns before we do, and we learn about them through your questions. So I'll say, first of all, I haven't heard this particular one, so I don't have a specific answer, but I will say one thing from reading. I probably try to read 5 or 10 medical articles a day that are coming out. There is so much information coming out about this every day through the medical press and the journals. That one thing I have learned is that lab data, so seeing T cells go up or antibody levels go up, is not predictive or enough to understand how that is going to affect our health and our future. You've probably heard an example I'll give of that is all the debate right now about who needs boosters that we've all been thinking about and hearing about for weeks now. Some people are saying, oh, well, antibody levels are dropping. And then others will say, but we don't even know what level of antibody you need to stay protected. And neutralizing antibody versus general antibody levels, T cell activity, et cetera, we are learning so much about this virus, but we certainly can't say anything yet about T cells. And what it appears to do, the vaccine, is stimulate T cells in a really good way. And we know that cellular immunity is important to help protect you from COVID, even after those antibodies start to drop. What we don't know is, how this is going to affect us in 5 or 10 years, other than what we know about other vaccines, and that they generally are much more protective. And I'm not aware of any other vaccine where there's any concern about long-term health risks such as you bring up. But thank you for the question. I think what we'll do is we'll maybe add this to our blog and some of our media sites after we've had a chance to research and see where that concern is coming from and get a more specific response to you about this concern.
Thank you.
Okay, thank you, Dr. Hahn. Our next question is going to come from David Mack.
Hi, David Mack with BuzzFeed. This is probably for Dave and Elke. Given the problem of violence against healthcare workers, not just in your state, but across the country in the pandemic, can you talk about what guidance or assistance you've given hospitals and medical clinics about their security and how to protect staff? Is that a concern that you're hearing?
Thank you. That's an excellent question. And yes, it definitely is a concern that we're hearing. We convene the hospitals on a daily basis, sometimes multiple times a day. And that is definitely a growing concern that we're hearing from our colleagues. And they are, working towards, how can they increase their security measures that they're taking at the hospitals. Clearly, we're hearing it more and more on the national media as well. Thanks to you all for being very astute and watching what's happening and listening and really having your ears to the ground. So we do, through our emergency response efforts, we have offered support to healthcare through our essential functions to help them bolster their security measures as needed. Right now, I think they're planning, they're doing just fine at the moment, but we're certainly standing ready as a state through our Idaho Office of Emergency Management, as well as our agency to help support them as needed. And Director, I don't know if you have anything that you would like to add.
Elke, I think you covered it.
Okay, our next question is going to come from Kevin Richert.
Okay. Hi, this is Kevin Richert from Idaho Education News, and I think this is probably a question for Dr. Turner. Last week when you were presenting to the state board, you talked about the modeling suggesting a peak of cases of about 21,000 per week in November. And I want to get a sense of how that compares to the earlier modeling and the modeling that suggested maybe 30,000 cases per week by October. Does this play out to be more cases spread out over a longer period of time, fewer cases? Does it translate into more hospitalizations, more pressures on schools because this is extended for 2 months as opposed to peaking at a higher level earlier? I'm just trying to compare this current modeling to the previous modeling and how the numbers play out.
Dr. Turner?
Thanks, Kevin. The models are based on two different assumptions, so they're not the same. It's not like they took one model and tweaked it. They're actually two different models. That's the biggest difference. The other difference is that the models are based on national data, and as you may have heard, in other parts of the country, they are actually seeing cases declining. And that's not the case in Idaho, but it is occurring in states, especially in the Southeast. So all of those things together, they're fitting a model to those data. So a couple of things here. In some parts of the country, they believe that their case counts have peaked and they are on the decline. We are not seeing that trend in Idaho. So the model is assuming that we're going to sort of start to plateau a little bit, and that would push whatever peak we expect to see outward past the mid-October timeframe. So that's one thing. The other thing is that model is also assuming that there's no vaccine available for children by November 1st, I believe is the date. And there was some assumptions built into the previous model that there would not be any vaccines available for children, period. So there's a couple of different assumptions, and that of course is going to change a model, and they are two different models. So that's mostly the differences. Is that helpful?
It is helpful, but maybe just to give a sense of how the current modeling plays out. I mean, what does this translate into in terms of overall cases, overall pressure on hospitals and schools?
Yeah, so you can't really see how well a model worked until you look backwards. And we always say that projection is not prediction. So what it tells us right now is that we are tracking, in Idaho specifically, we're tracking at the high end of the projections. And so if it holds true, we could see in mid-November, upwards of 20,000 cases reported in a week. But what we're hoping will happen is that our curve will flatten out like we're seeing in other states. if we can all do the right thing and get those case counts down, and we won't see that sort of peak in mid-November. We'll flatten that curve, and we may still hit a peak in November, but it would be a lower number of cases.
Thank you.
Okay, our next question is going to come from Rebecca Boone.
Hi, Rebecca Boone, Associated Press. Thanks for the briefing and thanks for taking my question. I'm also hearing increasing reports of healthcare workers facing animosity within their communities, sometimes from patients, sometimes from patient families, and sometimes just from community members. And many are saying that they believe misinformation that remains prevalent in the state is playing a large role in this. I'm wondering if you are finding that to be true also, and if so, what message do you have for some of the purveyors of this misinformation, including some of our prominent local and state officials and groups that, like the Idaho Freedom Foundation, that today said, or this week said, that hospitals were to blame for the overcrowding rather than unvaccinated folks?
Yeah, thanks, Becky. So I'll start, and then I'm going to turn it over to Director Jeppesen so he can be thinking about his comments. And certainly that's why I think I say this all the time as well, that why this forum for us is so important, so we can relay accurate information, we can tell you exactly what's going on. And it's very important for us to make sure that our messages are clear, that it's fact-based, that we're relaying that to you all and relaying that to the public. And then also, of course, through our social media, working with our partners, we have a whole public health infrastructure that's really trying to focus on making sure that we are delivering accurate and fact-based information. And Director, I don't know if you want to add anything else based on the rest of the question.
Yeah, and I would just add a few comments there. Thank you, Elke. And I think that was Rebecca that asked that question. Becky Boone, thank you for the good question. It's disheartening to hear that our healthcare workers have moved from feeling like heroes to feeling at risk. The message I would carry around that is and I said it in my comments, and Elke had said it as well, is we need to be thanking them. They are giving everything they have to help people. That's why generally why people go in the healthcare profession is to help other folks. And my request is reach out and thank a healthcare worker around you. They are experiencing significant challenges in their work, significant trauma as they care for these patients that they care for deeply. And the thing I would say is even those folks who are potentially hostile towards healthcare workers, when they have to go to the hospital, they're going to be cared for with the same compassion, care, and dignity as any other patient that comes through the door. And that's really a hallmark of our healthcare workers. And so my request is the healthcare workers need to hear from you right now. Their situation is pretty tough. And so please reach out and thank a healthcare worker. And then we, as Elke said, continue to share the best information we have, the facts that we have. We do that through every forum that's available at our disposal. Obviously, people can say and share what they think and what their views are. Our goal is to provide a place that provides accurate and clear information about what's actually taking place through the pandemic. And so we will continue to do that. We will continue to do that actively, and we'll continue to put out information to correct misinformation to the best of our ability.
Thanks, Director. Our next question is going to come from Kyle Fonensteel.
Thanks, Nikki. This is Kyle Fonensteel from the Post Register. I think this question is best lent towards Sarah Leeds. Do you have a sense of what the uptake rate is of the booster shot? And do you also know how many people in Idaho are eligible for the booster shot?
Thanks. Sarah?
Thanks. Yes. We, as we looked at, after Friday, this past Friday, when we looked at the data, once CDC had made their announcement, we could tell that at the maximum number of Idahoans who could get the vaccine as a booster dose at 6 months after their second dose was about 140,000. And that's folks, 18 and older, who may be working in a field with occupational risk or in the other categories that CDC recommended booster doses be given. And then was your other question about third dose uptake?
Yes, thank you.
Yeah, so as of the end of yesterday, when we pulled data from the Immunization Information System for Idaho, we had 17,485 third doses administered. Now, keep in mind that some of those, and I want to say about between 7,000 and 8,000, we assume were administered to immunocompromised individuals between August 13th, when that was approved by the FDA and recommended by CDC, and this past Friday, we had some in the middle of the 7,000 third doses administered, and now we have the 17,485 doses administered, and we do not have the ability to tell whether someone is immunocompromised or what their occupation is. So we'll only be able to track a third dose and not be able to tell if it's a booster dose or a third dose to an immunocompromised individual.
All right, thanks, Sarah. Our next question is going to come from Shiro Matsuzawa.
Thanks, Nikki. Shiro with KTVB. Earlier in the pandemic, we heard that the spread was coming from family gatherings, and then I know on this call particularly we heard about the cases in schools. I also know that there's been some backlash when it comes to sporting events or other events happening in the community, but is there a common place or type of gathering where people are becoming infected?
And that's a great question, Shira. And Dr. Turner, do you want to follow up on that?
Sure. Thanks, Elke. So it is a good question. And for the most part, a lot of transmission is still going on in households. But one of the challenges that we're having right now with doing investigations is that we are not getting very much cooperation from people who are becoming infected. And so our local investigators are unable to elicit contacts and to follow up and determine sort of that chain of transmission as easily as they were during the beginning of the pandemic. So I'm just going to throw that out there so that everybody understands that it's not for lack of trying, but we are missing a lot of data about contacts for that very reason, that we're not getting cooperation. That being said, a lot of the time people are not sure where they could have been exposed when they are spoken to, but we do have a lot of household contacts that are mentioned. That's the most common that's mentioned, quite frankly.
Okay, our next question will come from Ruth Brown.
Hi, good afternoon. This is Ruth Brown with Idaho Public Television. I have a question regarding pediatric ICU beds. It's my understanding that statewide, we do have a relatively short supply of pediatric ICU beds with or without the pandemic. So I was wondering, do you know how many we have? And can you maybe walk me through how those beds differ from adult ICU beds for the general public? How do they differ?
Great. Thank you, Ruth. They definitely do differ. I unfortunately don't have that specific information at my fingertips in terms of the numbers, but Dr. Hahn, I know that you have looked at this, and do you want to take the question, or?
Yeah, Elke, I don't know, and one of the reasons I don't know is that when we've talked about it before, it seems that there are some beds, just like we talked about adult ICU beds, that the number can change a little bit. I remember hearing on a call yesterday, things change very quickly, but that there were 5 pediatric ICU beds still available in the state, but that's not very many. As I think many of you know, many of our pediatric ICU patients get transferred out of state in certain circumstances, and yet our neighboring states are now also struggling with capacity. So it is definitely becoming more and more of an issue for us, but up until recently, not something that we've focused on. I don't know if Wayne is on or someone from preparedness, because they're the ones. Okay, I was going to say the preparedness program tracks those numbers the most closely, and they might have had a more recent estimate.
Okay, we'll track that down, but we'll move on to our next question is going to come from Ian Stevenson.
Hi, this is Ian Stevenson with the Idaho Statesman. This is probably for Dr. Turner, a follow-up to the question about the model, and apologies if you mentioned this already, but does that model that predicts the potential case numbers come November, does it include levels of what ICU beds and general hospitalization levels might be at that time if we reach that level? And is the state planning any other sort of contingency measures for if cases get to that point?
Go ahead, Kathy. You're on mute, Kathy.
You would think after 18 months I'd get that down. Thanks, Elke. So I'm not going to answer your question about contingency plans for the states. I think I'll kick that to Elke. But the modeling does include some estimates of hospitalizations and deaths. You'd have to give me a few minutes to go back and look at the model because I don't have it right at the tip of my brain. But maybe Elke, you can circle back to me while you're answering contingency plans, and I will look that up real quick.
Great, thank you. And Ian, my apologies. I'm going to have you repeat the second part of that question. The contingency plans for additional beds based upon the model?
Yeah, I guess this sort of depends on what the answer to that question is. But if levels of hospital and ICU beds are expected to get much higher, yeah, is there any particular planning for what we might do in that case?
Yeah, and I'll, while Kathy is looking frantically, we certainly, as I mentioned earlier, we talk with our hospitals every single day. We talk about their capacity. We talk about their overflow plans. We talk about contingency measures. And certainly each of the hospitals are preparing for increasing demands. But as we've also talked about in previous press briefings, and how I started my presentation was that while they might have beds available, it's the staffing that still continues to pose challenges for hospitals and clinics. They might have beds available, but they don't have the staff to staff those beds. So lots of contingency plans that are now reality plans because we are trying to get them additional staff. We're trying to get them additional space. And so we hope that that's why we just keep pounding on these messages about the importance of all of these mitigation measures and getting the vaccine and people wearing their masks is to keep the virus from spreading to the point where we do actually have that model as reality. We want to prevent that from happening and change that trajectory. And Dr. Turner, I don't know if you found what you're looking for.
No, I'm going to have to kick that one down the road.
Okay, looks like we're starting a round of second questions, so we'll take those till we run out of time. Audrey Dutton.
Thanks. This question is for Director Jeppesen or Dr. Hahn or really anyone else who'd like to chime in. Going back to the topic of misinformation and disinformation, what can be done in Idaho to hold people and groups accountable for disseminating this kind of information about COVID-19? Are you having any discussions with legislators or licensing boards to determine whether any laws or rules need to be changed? Do you have any other ideas for ways that Idaho could kind of fill in some of the holes that allow misinformation to spread rampantly?
Thanks, Audrey. I like that you picked your responders. So, Director, go ahead with that.
Yes, thank you, Audrey. That's an important question and appreciate you asking that. It's something that we worry about every day. We spend a considerable amount of time providing information as to our hospital partners in the public health districts as to what is accurate information about this pandemic and what's taking place and what the facts are. We live in a country that protects people's right to have an opinion on issues, and so that's a delicate space in terms of how that's managed. I don't want to speak for the oversight medical boards, et cetera, that oversee the professions, although I will say that they are actively engaged in making sure that the statute and rules, IDAPA rules that are in place are being followed, and if and when they have complaints, they will follow up on those as they would with any But it's, our job really is to make sure that we provide, along with many of our partners, accurate information that gives a counter some of this misinformation and gives people a place to go if they hear something that doesn't make sense to them or they want to validate. And that's where most of our time and energy is spent, is really pursuing the right information, getting out to the public.
Thanks. Just kind of a follow-up. It's a flood and it's impossible to fight back on, frankly. So the root cause seems to be the purveyors of this disinformation and misinformation, and it's not just in Idaho, it's across the country and the world. We do have some folks in Idaho who are spreading this information across the world as well. It's making its way across the world. So you don't see any opportunity for any kind of, I guess, accountability?
Audrey, great question. I think we're venturing into the space of policy, and particularly legislative policy. And so I don't want to speak on their behalf, and they'll have to wrestle, if they choose to, with those those questions that you're raising. So that's, one of the things I learned quickly in this job is I don't make laws. It's my job is to follow the laws and implement what they say. And so we'll look to the legislature to tackle, if they so choose, those difficult questions. In the meantime, it is problematic. And as you mentioned in your question, the first part of your question, the one place that we can look to is the licensing boards for folks that have a licensure. That would be their accountability to make sure that the requirements and the expected behaviors and ethics that those licensing boards put in place are being followed. And those aren't managed by the department, so I don't want to speak to them and what their actions may or may not be and what their purview is, as I'm not an expert on those areas. But again, I will say that those existing licensing boards for those healthcare professions and others, I know this is on their radar screen, and I know that it's something that they're talking about. And so it is a problem. We have people that are needlessly suffering in hospitals and from being sick, and frankly, we have people dying because of misinformation that's out there, and that's a real tragedy. Within the framework that we have today, what the department will do is continue to provide accurate information and support any of our sister agencies in any efforts that they undertake to help kind of rein in some of that misinformation, or at least provide accurate information so people can make a choice for themselves of whether they want, which part they want to believe. But again, I'll say that misinformation is causing real suffering for real people. I've had a chance to visit the ICU myself personally. I know some of the here on this call have had that chance. It's very real, and it's unfortunate, and we're going to continue to do our job to put the best information out we can to counter some of that misinformation.
Thank you.
Okay, I want to point out that Dr. Turner did put some information into the chat. I'm going to read it aloud for people who may not be joined in the WebEx app, maybe by phone, but she says new model estimates are hospitalizations could peak at 1,900 hospitalizations in a single week in late November, and deaths could peak at 305 in 1 week in late November. And that was in response to Ian Stevens' question a little bit earlier. We'll move on to our next question, and that's going to come from Rebecca Boone.
Thank you, Rebecca Boone, Associated Press. I just wanted to follow up on with Elke in regards to the question on assisting with security efforts if needed. You said that you guys have been offering support through essential functions to help bolster security measures, and then you're also planning ahead for future support that may be needed. Can you give me some specifics on what that support looks like and what the plans involve in case a need for greater security arises?
Sure. And I probably could do a better job of explaining this, but part of our emergency response structure in partnering with our Idaho Office of Emergency Management is looking at many essential functions that support our emergency response plan. For example, Department of Health and Welfare, we are the lead agency on ESF 8, Essential Function 8, which has to do with healthcare. There are other essential functions that have to do with safety and security, for example. So that is one where Idaho State Police takes the lead on that. So part of what we even talked about today on some of our calls was how can we bring our ESF partners to the table to help problem solve with the healthcare providers or the hospitals and clinics around the state. So just sort of kind of enhancing or kind of a pre-notification that they might be needed to help support some of our partners. So as I said, the hospitals right now seem to be operationalizing their own emergency response plans and working with whomever they might have contracted locally as a security detail or however they might have that rolling out. But then we can come in as state agencies in the state system to help reinforce that or help bolster that if need be in a community. And that's a very rudimentary review of how that works, but that's kind of along the lines of what we would do to be able to help them.
All right, thanks, Elke. I want to point everybody back to the chat. Dr. Hahn posted some information there about pediatric ICU beds. There are 21 pediatric ICU beds licensed in Idaho. And I think that was in response to a question from Ruth Brown. Looks like we have our final two questions. The second to last one is going to come from Kyle Fonensteel, and then the last one will come from Ruth Brown. So Kyle, the floor is yours.
Thanks, Nikki. This is Kyle with the Post-Register. I just wanted to ask about the gap in vaccination rates and partial and complete vaccination rates. There's about an 8 percentage point gap between those two rates for the eligible population. I'm wondering how big is this in terms of people? You know, why is this happening, and is this something that you expected?
Thanks, Kyle. I'm going to ask Sarah Leeds if she'd like to respond to that.
Yeah, and I heard the question, but Kyle, I want to get some clarification. When you say there's an 8-point, can you just repeat it, please?
Yeah, full vaccination rates for all eligible people in Idaho, like 51.9%, and the partial vaccination rate is 57.9%. So, you know, like just asking for more information about this gap.
So partial vaccination would be when folks have chosen to get one dose and either they're waiting the 28 days for Moderna or the 21 days for Pfizer. They're in that period of waiting, or they've chosen not to get it. And so partial, they're considered partially vaccinated.
Yeah. I heard from a provider like a month ago that they had heard about a surprising number of people who hadn't gotten their second dose just because of convenience issues. So I wanted to see what was happening on the state level.
Are you asking what we're doing about that?
No. What's your understanding of like this issue? You know, how wide is it? And do you know why people are waiting?
Oh, I see. Okay. Yeah, I mean, we've heard, same as you, we've got some anecdotal stories about, I've heard personally some teenagers that have, and even adults that have gotten a vaccine and then maybe been persuaded by misinformation to not get the vaccine, the second dose. Maybe they just are not wanting to take the chance on side effects because of work and being out of work for a day or two. Those are some of the reasons that we're hearing. And we continue to just urge people to get that second dose. We now have Janssen, which is one dose, as you know, more widely available, and providers are ordering that now again. And so, you know, we're trying different strategies across the state to encourage people to complete the vaccination, become fully vaccinated with either 2 doses of a 2-dose series or the 1 dose of Janssen. Did that answer your question?
Yeah, and then do you know how large this group of people is, the people who haven't gotten their second shot?
just through, no, I couldn't tell you right now. I'd have to look at the data, but we've got on our home page, we know that there are people who've received 1 dose of a 2-dose series at 91,197 people. And what I really couldn't tell you is who among them, without looking at the data, of how many of those are way beyond their that period of 28 days for Moderna or 21 days for Pfizer. But we could get back with you with that.
Thank you.
You're welcome.
Okay, thanks, Sarah. Our last question is going to come from Ruth Brown.
Hi, thanks, Nikki. I appreciate everyone's time today. This is a question for Director Jeppesen, and it might sound strange coming from me, but the reason I'm asking is because I also am trying to combat misinformation. So, Director Jeppesen, could you clarify, do hospitals receive any incentives, financial or otherwise, to request crisis care standards be implemented if it were not an actual crisis? Do they receive any kind of incentive?
Well, that's easy, Ruth. Thank you. No is the answer to that. They do not receive an incentive to ask for or operate in crisis standards of care.
Thank you.
Okay, well, we do have a minute left, and Ian Stevenson sneaked one more hand in there, so we'll go ahead and take his question, and this really will be the last question.
Thank you, I appreciate it. Just a quick follow-up, Dr. Turner. Thank you again for following up with that hospital data. First off, is that 1,900 new hospitalizations in a single week predicted? And then second, by way of comparison, how many like this week are hospitalized? Because I know on the dashboard that I see it, there are, for instance, 774 people hospitalized as of September 24th, but I'm not sure how many of those are new or, people who've been hospitalized a few weeks ago previously.
Dr. Turner?
Yeah, so Ian, so a couple things. Yeah, those are incident hospitalizations, so occurring in not a census, but new admissions. I think is the best way to probably think of them. Mm-hmm. And you're right, the data on our dashboard do not show incident hospitalizations. They show the census of patients who are hospitalized. And we do have the data about admissions, but it has to be, I'll have to get to it. But it would definitely be, since we have a census that is half of what the model would predict the worst case scenario is, you can well imagine they all didn't show up at the hospital yesterday. So it would definitely be a huge burden on the hospitals.
Good. Thank you.
Okay, we'll go ahead and wrap it up for today. We're planning another media briefing in a week on Tuesday, October 5th at the same time. Thank you all for joining us today. Have a good rest of your day.